Hi, I'm Dr. Radbill. I'm the medical director of Renew Us and clinical provider for Healthy Futures. At Renew Us, we do a bunch of videos every couple weeks, and today the topic I want to talk about is hypertension or high blood pressure. Um, this is a very important topic because hypertension is one of the most common diagnoses made in this country. Over 86 million Americans suffer from high blood pressure, and the consequences of high blood pressure are quite significant: heart disease, stroke, end organ damage. And one of the biggest problems I have with my patients is conveying just how important their blood pressure is and why controlling their blood pressure is so important. Frequently, I'll get patients that come in on successive visits and their blood pressure is elevated a little or maybe a lot, and I'll hear, well, I'm in a lot of pain today, or I drank too much coffee, I just ran up the steps, and people don't have any symptoms. None of us have symptoms for high blood pressure. So that's why it's difficult to convey why it needs to be treated. So that's really the purpose for today's video. So I like to explain to my patients, our blood pressure is really an equation. There are two things that determine our blood pressure: our heart and the resistance in the blood vessels. So imagine your heart is pumping and the blood vessels are nice and open. They're the pipes, right? Just like a plumbing system. Now, if the pipes are open and dilated, the heart is pumping. It's not working hard at all. It's smooth. It's just pumping and the blood is flowing very smoothly. That's how you want it. That's when your blood pressure is lower. And by the way, some people will say, well, how low is too low of a blood pressure? Well, as long as you're not in shock and losing blood, the best blood pressure is the lowest tolerable blood pressure. As long as you're walking around and not having any symptoms, then a low blood pressure is good because your heart is not working hard. It's relaxing. So the heart is a muscle, right? And just like your bicep muscle, if you exercise, your bicep gets bigger. Well, if your heart is pumping, and let's say those pipes are now clamped down, the muscles and the arteries are tighter. So now it's got to work harder. It's got to push harder to push the blood through there. That's harder work on the heart muscle. The heart is a muscle. The muscle gets bigger, just like your bicep muscle. The problem is it gets bigger on the inside. And this is also a process that occurs over many years, maybe even decades. So the chambers inside the heart that fill with blood get smaller because the muscle's getting bigger. And what happens is the blood then flows backwards into the legs and into the lungs, and you get what's called congestive heart failure. So that's one of the long-term consequences of hypertension. Of course, there are many others: stroke, heart attack, kidney disease, one of the leading cause of kidney disease, impotence, visual problems. It can damage, the blood vessels in the eyes, circulation to your legs. The other part of the blood pressure, we talked about the heart. So now you have the blood vessels, right? So if the heart is working harder, if the blood vessels are clamped down, the lining of these blood vessels, it's lined by these cells, they're called endothelial cells. And it's very smooth. And nothing is really going to stick to the lining there unless it's irritated. So if the blood is pumping harder, it's going to maybe irritate the lining worse, and then plaque will start to accumulate. That's also how we get complications from hypertension. And other things that will also irritate that lining or would be like cigarette smoking. Nicotine, people think if they stop smoking and they're still using a nicotine substitute, it's not harmful, but it still is very harmful because the nicotine is like sand in the blood vessels. It irritates that lining. Other things would be a poor diet, a diet rich in saturated fats, processed foods. Diets rich in antioxidants are good. The Mediterranean diet is rich in antioxidants. Antioxidant means anti-inflammatory, and I do talk about this in other videos, but antioxidants don't irritate the lining and protect the lining. So you want to prevent oxidation. That's why the term antioxidant. So now what is the definition of hypertension? What are the numbers that we consider elevated? Now this has changed over the years. Many times it's become more and more strict, these numbers. There are different levels of high blood pressure. We have the American College of Cardiology. We have the American Heart Association. We have the Joint National Committee. These are the three bodies that say, you know, this is the best blood pressure. This is stage 1 hypertension, stage 2. I'm not going to talk about that. I'm just going to talk about where they all agree our blood pressure should be. And that is, our blood pressure should be less than 120/80. So the top number, the systolic, 120, you want it less than that. The bottom number, 80, you want less than that, the diastolic. And what are these numbers? What do they represent? You know, how do we come up with this? Well, that's another good thought, because another good question, because the systolic is your heart squeezing. That's what that number represents, your heart squeezing. The diastolic is your heart relaxing, and when your heart relaxes, it fills with blood. So if your systolic is elevated, it's squeezing too hard, or maybe stiff. It's just not, it's squeezing too hard. If your diastolic, your bottom number, is elevated, now it's not dilating all the way, it's not opening all the way. And if it's not opening all the way, it's also stiff. So that's why certain medications will work on, you know, the blood vessels to dilate them. Certain will work on the heart to relax the heart more. And that's why it's important sometimes that we address both the top number and the bottom number. You want both of those numbers to be in the perfect range. So there are two different types of hypertension. There's primary and there's secondary. It's that simple. Now, 95% or more of us have primary hypertension. It's genetic, it's environmental, a combination of the two. Secondary is really a secondary cause, like a renal artery stenosis. Your kidney artery is clamped down, and that can cause high blood pressure. Or certain tumors that secrete certain hormones can cause secondary hypertension, and you can basically cure the hypertension by getting rid of the tumor. But those are very rare. Most of us have what's called essential hypertension, which is genetic/environmental. Now, I say it like that, genetic, environmental, because you may have a genetic tendency towards hypertension. Everyone in your family has it. If everyone in your family has it, the chances are you're probably going to get it. Now, you might be able to fight that by changing your environment. When I say changing your environment, keep your weight perfect, eat healthy, reduce your sodium intake. You know, all these changes you can make. But let's say you have a little bit of a genetic predisposition and you gain a significant amount of weight. When you get to your 40s or 50s, you're probably going to develop hypertension. So once we make the diagnosis of hypertension, now what do we do? Well, we have to determine if there is end organ damage, if any complications have occurred as a result of your blood pressure being up. So we're going to do certain tests like blood work, you know, make sure your kidneys are functioning good. We do like a CBC and a CMP. We're going to do an EKG to look at your heart, a chest x-ray, maybe an ultrasound of your heart to make sure it's expanding all the way and squeezing all the way, you know, diastolic and systolic. We may want to do a urinalysis to make sure there's no protein in your urine. And so once this workup has been done, the next step is treatment. Now, do we want to put you on medication right away? And the answer is no. We want to see if we can do lifestyle modification. The Joint National Committee does recommend lifestyle modification as a first-line way to treat high blood pressure. So what do they recommend? Well, they recommend a low-salt diet, reducing your sodium intake to less than 2.5 grams a day, which is not a lot of salt. You could not add salt to any of your foods, and you would still be way over 2.5 grams. There's just a lot of sodium in foods naturally. Weight loss, decreasing alcohol intake. In men, we want you to drink less than 1 ounce of alcohol a day. That's 1 drink a day. In women, less than a half an ounce a day. Now, that doesn't mean if you haven't had a drink for 6 days on the 7th day, you can have all 7 ounces. You also want to stop smoking. You want to maintain good intake of calcium and magnesium. Exercise at least 30 minutes a day every day if you can, and follow a Mediterranean diet. So these are the recommendations. that to treat hypertension as a first-line treatment. Now, once that has failed, the next thing we do is consider medication. So when I was in school in the late 80s, early 90s, we used what's called a step method, right? So you'd use a certain medication like a thiazide diuretic, and you would max that medication out to the highest dose. And if the blood pressure was still up, you went to the second step. You added like a beta blocker, and then you'd max that out, and so on. And you keep going from one class to the next, maximizing each dose. The problem with that method is we found that side effects tend to be dose related. So putting people on high doses of one medication can cause a lot of side effects, when the better option is low dose of maybe 2 different medications. The nice thing about that is now you're taking care of high blood pressure by attacking 2 different aspects of it, maybe a little bit of the heart rate, maybe a little bit of the peripheral resistance, the blood vessels, and there's low incidences of side effects. That's why they make a lot of combination blood pressure pills nowadays. Also, we'll look at other factors when deciding which medication to use. Sometimes you can kill 2 birds with 1 stone. You know, does somebody have diabetes? Well, if they have diabetes, we want to use maybe an ACE inhibitor and an ARB. It protects your kidneys. If somebody has heart failure, you may want to use a beta blocker. So these are really the cornerstones of treating high blood pressure. It can be challenging, you know, to a physician, because some patients who have really strong genetic forms of hypertension, you can have them on 3, 4 medications and it may not work. But the ultimate goal is really to change your lifestyle, treat the high blood pressure as necessary, and if you do, people are going to live longer. They're going to have less heart disease, less strokes, but they're also going to have a better quality of life. Having kidney disease and problems with your eyes and vascular problems and impotence, you know, these are all things that we all wish to avoid, and you know, that's why we're here doing this. So if you have any questions, we invite you to call us at any time. The number here is 888-985-2727, and I'm Dr. Keith Radbill, and I look forward to our next video. Thanks.